I want to talk about sciatica. So many of my patients come in and they say, "Doc, I have sciatica." And as we start talking about it further, I ask them, what exactly is sciatica? And most people really have no idea, but they do know that it's pain that radiates down their leg, and that's actually correct. Not all pain that radiates down the leg is sciatica, but oftentimes it is. So what is sciatica? So this is your lumbar spine. Your lumbar spine is the low back. It's the bottom 5 vertebrae or bones in your low back. Our bones are separated by shock absorbers, and those shock absorbers are known as discs. Many people have heard of a herniated or bulging disc. Oftentimes, discs will leave their proper place due to lifting something heavy or being placed under pressure, even with something as simple as coughing or sneezing. And when they leave their home, they can move to the left, they can move to the right, they can move back. And sometimes they actually pinch a nerve that contributes to the sciatic nerve, and that can cause pain radiating down one or both of your legs. Sciatica usually is not an emergency, although it can be if there's profound numbness, you can't move your leg, or you develop something called a foot drop, meaning that your foot is slapping on the ground and not lifting up. If that were to happen, it's super important to go to an emergency room or see a doctor immediately, as these things can usually be surgically corrected, and oftentimes you can reverse any potential for permanent damage. However, more often than not, the issue is actually pain and not a neurological issue or dysfunction. And when the issue is pain, an interventional pain management physician like myself can properly diagnose and subsequently treat the problem, usually without surgery, so that a patient can experience less pain, perhaps even 100% pain relief, and get back to their usual active and happy lifestyle.